Greetings. I'm Brandon Jones, Executive Director for Minnesota Association for Children's Mental Health. And we're an organization that provides education and resources to professionals, families, and youth. And like many of you, we've noticed the crisis that has been going on in many communities throughout the nation. We're seeing soaring rates of stress, anxiety, and depressive symptoms among many of our youth and adults. And we're not the only one who've noticed this. Now there has been a national emergency that has been put out for both children and adolescents around the mental and emotional turmoil that has taken place during the pandemic. And there have been declarations and aims to fix these and address these issues that are facing communities all across the nation. And as an organization that has promoted positive mental health for infants, children, adolescents, and their families for the past 30 years, we would like to echo the call to these challenges that many young people and their families and just communities in general have faced throughout this pandemic. Prior to the pandemic, Minnesota, like many places throughout the United States, have been plagued with the challenges in the area of mental health, such things as not enough mental health resources in schools, not enough providers to meet the demand, and increasing suicide rates amongst young people. These challenges have only been complicated due to the demands and strains of the pandemic. It's frustrating, I get it. And we're an organization that's dedicated to doing anything that we can in our power to make sure that young people, their families and communities have the resources that are needed when it comes to their mental and emotional health. While the past year has been difficult for many of us, we know that marginalized groups such as BIPOC community, Black, Indigenous people of color, as well as the LGBTQIA+ community have continued to struggle throughout the dual pandemics of COVID and racism during this time. And we know that access to care for these populations continues to be a struggle. And we have to continue to find creative ways to not just address their needs, but make sure that we're improving the field altogether. And this is why MACMH is here to continue to provide these positive mental health services and offer something as an alternative to help folks handle the things and the challenges that show up in their life on a day-to-day basis. So here's what MACMH plans to do. This is our call to action. We're going to champion at least 4 of these declarations. The first one is around school-based mental health. We plan to support effective models of school-based mental health. We understand that school is one of the best access points to make sure that young people get the quality mental and emotional health services that they deserve and to engage families around the process. Our second declaration is around suicide. We plan to strengthen efforts to reduce suicide in children and adolescents. In 2001, the Trevor Project completed a survey where they determined that 42% of LGBTQIA+ youth had considered attempting suicide in the past year, and more than half of those were non-binary and transgender youth. This is a huge problem for us. More than 80% of the LGBTQIA+ youth stated that COVID-19 made their living situation even more stressful, with 1 in 3 of those youth staying at homes that were not LGBTQIA+ affirming and friendly. The third declaration is to support trauma-informed care services. Now, over time, trauma-informed care services has developed multiple different meanings for people. But one of the things that we have to keep in the center of that is the well-being of the people doing the work, as well as the clients, patients, and participants in our programs to make sure that they're meeting the needs, especially from a cultural standpoint. It's important for us to understand that in order to service people, we have to make sure that we meet their cultural needs. And we can't be afraid to meet their cultural needs and make adjustments within our programs to meet their cultural needs. Meeting people's cultural needs is key to their ability to heal. And we are encouraging everyone to consider that as we continue to develop and move forward in what we call trauma-informed care. And the fourth declaration is addressing the workforce challenges and shortages that that unfortunately limit the ability for children to access quality healthcare services. And addressing this shortage means that we have to get more people involved and become mental health providers. And sometimes that means that they might not become actual licensed therapists or counselors. There may be other therapeutic needs that we can bring into the fold and continue to support that are therapeutic in nature. And being able to do that gives communities and families different types of access to healing. We hope that you're taking the best possible care of yourself at this time. And please know that MACMH is here to support you, your family, and the communities that you're a part of. Please visit our website, macmh.org, in order to engage with one of our family coaches and to get resources if necessary. And with that, we will see you around. Please take the best care of yourself. Bye.